Namaste everyone, this is Bharti and today on this platform I'm going to talk about my experience which is against breast cancer. Yes, to be very precise, I'm going to talk about how I found out and how you can keep check on yourself. So starting with how I found out and we'll later on continue with how you can keep check on yourself. So I'm 30-year-old, I have a 1-year-old boy. जब मुझे पता चला तब वो 6 महीने का ही था. So what symptoms I had initially, like I had 2 lumps on my left breast, एक यहाँ पे और एक underarm पे. Initially they were very small in size and hardly any pain, but later on they were like tennis ball size and there was like throbbing and stabbing pain, like धक धक वाला pain होता था वहाँ पे and color changes also started. तो I found it initially जब मैं अथर्व को दूध पिलाती थी और वो 3 महीने का था. 3 महीने के आसपास मुझे लम्प्स फील हुए. आई स्पोक टू एल्डर्स, सब ने कहा कि दूध की गांठ होगी, जस्ट प्रेस इट लिटिल हार्ड और यू विल फाइंड सम रिलीफ, बट ऐसा कुछ नहीं हुआ. देन आई वेंट टू द डॉक्टर. डॉक्टर ने भी सेम स्टेटमेंट दिया कि येस यू आर ब्रेस्ट फीडिंग एंड दिस इज मिल्क डक्ट, जस्ट इट विल गेट रिजॉल्व आफ्टर 6 months. तो कम टू मी आफ्टर 6 months, बट आई वॉज नॉट सेटिस्फाइड बिकॉज दे वर क्वाइट अ पेनफुल. तो आई वेंट टू अदर डॉक्टर. डॉक्टर ने कहा, द अदर डॉक्टर शी सेड कि दूध इकट्ठा हो गया एंड दिस विल गेट इन्फेक्टेड, सो जस्ट गेट एंटीबायोटिक एंड सम पेन किलर्स एंड यू विल फाइंड सम रिलीफ. मैंने सेम रूटीन फॉलो किया. आई टुक दोज मेडिसिन बट नो रिलीफ, ट्रस्ट मी. देन अगेन आई वेंट टू द सेम डॉक्टर. शी सेड कि नाउ आई विल गिव यू सम हैवी एंटीबायोटिक्स एंड ये एक जगह पे इकट्ठा हो गया और ये रिजॉल्व हो जाएगा जैसे जैसे एज सुन एज यू स्टॉप फीडिंग योर बेबी. I was like, okay, fine. I took those antibiotics and the painkillers, but trust me, no relief. Then I changed the hospital. I went to the Chandigarh, जहाँ पे मेरी डिलीवरी हुई थी, Alchemist, and we met the doctor there. And doctor was so shocked looking at the size of those lumps, and she immediately sent me under investigations like ultrasound, and they took my biopsy, where they found out that I am suffering from stage 3 breast cancer, and we were like very shocked because on that very day my baby turned 6 months, and without wasting a single day, we rushed to Gurgaon Medanta Hospital, where we met Dr. Kanchan Kaur and Dr. Ashok Vaid. And Dr. Kanchan Kaur is actually breast cancer specialist there, and Dr. Ashok Vaid is specialist for chemotherapies. So initially, they prescribed me some tests, blood test, investigations, other investigations. So in my investigations and my blood test, 2 very important things we found out that my BRAC, which is BRAC, is positive, which means that this is my genetical history, like my father had, my uncle had, and my grandfather had. So this is genetical, which means my treatment would be very strict, which is chemotherapy and both the breast removal and the ovaries removal, because the chances of reoccurrence are high in genetically patients. So they said this is the treatment regimen, we are going to follow this. We were like, fine, ठीक होना है, जो करना है करो, बस ठीक कर दो. So and the second important thing we found out that this is a metastatic breast cancer, which mean it got spread like we were like very shocked क्योंकि वो जो breast cancer था वो lung में भी spread हो गया था. But anyways, we went to a second opinions also, and they said doctors were like not giving any satisfactory response. So anyways, keeping hopes high, we started our treatment at Medanta. So I completed my 16 chemos. I took all the 16 chemos successfully without any major side effect. The initial and the only and the very toughest to accept symptom was alopecia, which is hair loss. But anyways, time passes and it passes very nicely with the God grace. So I have completed my 16 chemos. Then doctor asked me to went under PET scan again so that they can see the progress. So I went under the PET scan, and there they found out that they were like very small dead cancer cells in my lung, लाइक लंग का कैंसर ख़त्म हो चुका है, डेड सेल्स है. ब्रेस्ट कैंसर रिड्यूस टू लाइक द ट्यूमर साइज रिड्यूस टू लाइक हाफ, and but the major thing they found out that it is in my bone, and we were like so devastated at that time. So doctor said immediately go under MRI bones. Then I went under MRI, but luckily we prayed so hard, and can you imagine, next day the MRI was totally clear. There was nothing in my MRI report, nothing, and we were like thanks God. So and the doctor changed their complete treatment regime. Initially they were very ardent about doing surgeries for a removal of my breast and the ovaries, but after this scan they said ki you don't need anything, you just take one tablet called olaparib and that's it. Come second weekly for checkup, because you know after taking olaparib your hemoglobin downs very immediately, but भगवान की दया से सब कुछ नहीं हुआ, एंड माई हीमोग्लोबिन इज almost like 11.5 12 11.5 12, which is because of yes my routine. I followed very strict routine which I'm going to share with you in my next video. So this is how I found out, and so now I will tell you how to keep check on yourself. So the best period to check on yourself is after periods. आपके पीरियड्स जैसे ही ख़त्म होते हैं उससे 1 से 2 दिन बाद तक आप चेक कर सकते हो अपनी ब्रेस्ट को खुद, क्योंकि उस टाइम पे आपकी ब्रेस्ट बहुत सॉफ्ट रहती है और कोई छोटा सा चेंज भी आपको पता चल जाएगा. अगर आप पोस्ट मेनोपॉजल हैं तो आप कोई भी महीने का ऐसा दिन रख लीजिए जिसमें आप रेगुलरली चेक करें हर महीने, ठीक है. बेस्ट पोजीशंस क्या है, आप थर्ड इज़ व्हेन यू आर टेकिंग शॉवर, बिकॉज तब जो पानी बह रहा होगा और जो सोप लगा होगा दैट विल हेल्प योर हैंड टू ग्लाइड प्रॉपरली, तो उससे भी आपको पता चलेगा कि कुछ चेंज तो नहीं है. फोर्थ थिंग विच यू हैव टू कीप इन योर माइंड दैट बी अवेयर अबाउट योर बॉडी. क्या कलर है आपकी ब्रेस्ट का, कोई लंप तो नहीं आ रहा है, कोई साइज में अल्ट्रेशन तो नहीं आ रही है, कुछ पेन तो नहीं हो रही है. बी अवेयर अबाउट दिस सो दैट कभी कोई चेंज आए तो यू विल गेट टू नो इमिडिएटली, right? So follow this routine and you will find if there would be any change initially. और अगर नहीं पता चलता है, कुछ confusion है, you have found some lump, there is a pain, तो immediately I request you go to the doctor. Don't wait for anything, don't follow any home remedies, don't do anything, just go to the doctor for once at least so that you will get properly guided. Okay, thank you so much.